Hello, I am Dr. Yogalakshmi, Associate Consultant working in Care Hospital, High Tech City. Actually, today we thought of putting a patient educative video on anemia, the most common problem for which the patients come to us. So, anemia can be of many types. So, what is the signs and symptoms of anemia? First, the signs and symptoms will be in the form of increased fatigability, increased breathlessness, there can be loss of appetite, there can be hair fall, and for children there can be simple things like not able to concentrate at school, not good performance in the education, and also there can be something like a memory loss. And for adults there can be shortness of breath while walking, while climbing to the stairs. So this kind of symptoms can be there in the anemia. And signs, mainly we see the patient can have pallor, like the skin will be turning white. So these are all the symptoms of anemia mainly. So what kind of etiologies are there for anemia? There are many causes which can cause anemia, like the first main thing is nutritional. Nutritional is because of the deficiency of iron, the deficiency of vitamin B12 and folic acids, which can cause anemia. The second cause is increased loss of blood. That can be because of the trauma or something acute causes, or it can be because of small losses which cannot be visible in the eyes, like through the gastrointestinal tract or through the lungs, which we cannot observe with the naked eyes. And next cause is increased destruction of the blood. That can happen in conditions called hemolytic anemias. That can be inherited from the parents or it can be acquired, where the blood cells will be destroyed by our own body, by our own immune system, where the cause is usually not known. So different kind of anemia has different treatment. And the fourth most important cause is aplastic anemia. The aplastic anemia is an anemia which is caused due to the low production of blood cells from the bone marrow. All the blood cells, like the white blood cells, hemoglobin, and also the platelets are produced from our bone marrow, and the cells called the mother cells or stem cells, if there is reduced number of the stem cells, then that can cause aplastic anemia. There are different kind of aplastic anemia also, and the treatment differs according to which aplastic anemia the patient is suffering. An important question which all the patient asks is anemia really dangerous? I'll say anemia is really dangerous when the hemoglobin falls below a certain level, which we call as severe anemia. But initial stages of anemia itself can be a problematic thing, like loss of concentrating capacity for a young school-going child who is studying well. Because of anemia, there can be deterioration in the education capacity. The anemia signs and symptoms mainly depends upon the level of anemia. So what are all the investigations which we do for anemia? The basic investigation is complete blood count, which gives hemoglobin and many other parameters. So with the hemoglobin, we can say whether the patient is having an anemia or not. Less than 12 gram per deciliter hemoglobin in a female is considered as anemia, and less than 13 gram per deciliter in a male is considered as anemia. But the symptoms of anemia occurs when further drop in hemoglobin takes place, say less than 10 grams, like that. So what are the risk for who are at high risk for developing anemia? The patients who are at high risk for developing anemia is mainly the women and children in the growing age. Those patients are risk for nutritional anemia, but there can be risks for other types of anemia like aplastic anemia and hemolytic anemia in young patients, whether male or female. And there might be some bone marrow problem which also can lead to anemia, even the blood cancers which can present as anemia. So there always, if there is symptoms and signs of anemia, it is better to take a complete blood count and consult a hematologist or a physician if there is a severe anemia.